Hello everyone, my name is Alia, and if you're just seeing this video for the first time, welcome to my YouTube channel. Please don't forget to subscribe to my YouTube channel and drop a like under this video. Thank you. In this video, I'm going to be showing you the simplified version of blood flow to the heart. Are you a nursing student or a student that has been struggling to learn blood flow to the heart? Or you're someone that just wants to know more about the blood flow to the heart, then this video is for you. So too much talk, let's just get right into it.
So let's begin. But before we move to the blood flow to the heart, we're going to do a little revision on the human heart just to jog our memory. So we're going to use the 6S. So the first S is the system. We know that the human heart is an organ of the cardiovascular system. Then the size of the human heart, we know that it is 310 gram in male and it is 225 gram in female. Now, what is the shape of the human heart? The shape of the human heart is triangular or cone shaped. So what is the situation of the human heart? That is where it's located. It is lying in the 3rd to 5th thoracic vertebrae in the mediastinum. In the mediastinum. And I'm sure we know what is the mediastinum. So what is the structure of the human heart? It has 3 layers, which is the pericardium, myocardium, and the endocardium. And what is the supply for the human heart? The supply for the human heart is the coronary artery. So I hope this was able to jog your memory. So let's move on to the blood flow through the heart. So let's try this video without my microphone. So this is the diagram of the human heart. I drew this human heart by myself, but I used the Rose and Wilson Anatomy and Physiology textbook. I'm sure you guys know it. So let's go ahead to label some of the parts here first. So let's begin again. So this is the arc of aorta. This is the arc of aorta. Then this here are the branches of the left pulmonary artery. So branches of the left pulmonary artery. Then here, this one here is our left pulmonary vein. This here is our left atrium. This is our left atrium. This is our aortic valve. These two valves here, they are left atrioventricular valve, but you know it's also known as the mitral valve or bicuspid valve. So I'll be writing mitral / bicuspid valve. You know, these are our right side of the heart, then these are our left side of the heart. So this place here is the left atrioventricular valve, also known as the mitral valve or bicuspid valve. So moving on, this here is our left ventricle. Now we have the left atrium above, so this below is our left ventricle. Then here we have our interventricular septum. Sorry about that. Interventricular septum. So we're labeling the right side of the heart. We're done with the left side already. So with the right side of the heart, so we're starting with the two largest veins in the body. That's the superior vena cava and the inferior vena cava. Let me put this down this way. Superior vena cava. And then we have our inferior vena cava. Our inferior vena cava. Then we have our thoracic aorta, this. Then this is our right atrium. This here, this is our right atrium. Then this is our right ventricle. This place here, this is our right ventricle. Then we have our right pulmonary veins. Then this is our valve, our pulmonary valve. This here, this is our pulmonary valve. Then we also have, what else again is left? Did I leave anyone out? Okay, we have this one here. We have the branches of the right pulmonary artery. With that, I can say we are done with labeling the human heart. So when I checked back, I saw that I missed labeling the tricuspid valve, which is also known as the right atrioventricular valve. So let's start with the blood flow through the heart. So the superior and inferior vena cava will empty their content, which is the blood, into the right atrium. So the blood in the right atrium, when it gets filled up, it will move to the right ventricle through the right atrioventricular valve, which is also known as the tricuspid valve. This tricuspid valve will prevent the backflow of the blood, which is now in the ventricle, to prevent the backflow of blood here into the atrium. So when the blood gets to the ventricle, it will be guided into the pulmonary artery by the pulmonary valve. This is our pulmonary valve from the label, if you can see. So the blood from the right ventricle will be guided into the pulmonary artery by the pulmonary valve. So when the blood gets to the pulmonary artery, it divides. See the branches, the right branch of the pulmonary artery and the left branch of the pulmonary artery. Can you guess where this is going? If it gets to the lung, you guess right. So the blood here now is now going to the lungs. So this is going to the right lung, this is going to the left lung. And what is it going to do there in the lungs? Going there for gaseous exchange. Let's take note that the blood that is moving from the pulmonary artery, that is the right and left pulmonary artery, to the lungs, is actually deoxygenated. So it's going to the lungs as gaseous exchange is going to take place in the lungs. It's going to oxygenate the blood. So oxygenated blood is going to come into the left atrium through the pulmonary veins, and we have the right and the left pulmonary veins. So this one is coming back from the right lung, this one is coming back from the left lung, but they all enter into the left atrium, and the blood that is entering there is actually oxygenated. Before it was deoxygenated when it was going through the pulmonary artery, but now that is coming back through the left pulmonary vein, it is oxygenated. So the oxygenated blood now in the left atrium is going to pass to the left ventricle through the opening of the left atrioventricular valve, which is also known as the mitral or the bicuspid valve. So when the blood now is in the left ventricle, it's going to be guided into the aorta. See, it's going to be guided into the aorta. This is it. By the aortic valve. And where is the aortic valve? See it here. This is the aortic valve. So the blood in the left ventricle is going to go into the aorta, but it's guided by the opening of the aortic valve. I hope you get this. Let's not get confused. Let's take it again. Oxygenated blood is moving from the lungs back into the left atrium, passes into the left ventricle by the opening of the left atrioventricular valve. So this blood is now guided into the aorta by the opening of the aortic valve. This aortic valve here. You know, valves are what allow blood to pass through them. In cardiovascular, the valves, they allow blood to pass through them. In the lymphatic system, they allow lymph to pass through them. But this one here is the blood, and it's guiding it into the aorta. So the blood now that is in the aorta will now go back into the body for systemic circulation. Let's not forget that all this is happening within seconds. The movement of blood flow through the heart is happening within seconds. So the atrial contracting and the ventricle contracting, they're all happening within seconds. So I hope I was able to explain blood flow through the heart to the simplest form so that you can get it. And once you get this blood flow through the heart, you'll never forget it. Yes, if you really learnt it wholeheartedly, you're not going to forget it. That's one thing with it, and you end up even loving it. So if you got to this point of my video, thank you very much. Please don't forget to subscribe, give this video a thumbs up. Please drop a thumbs up under this video and comment. If you want me to do cardiac cycle or whatever, or if you have a question for me, just drop it in the comment section and I'll happily reply you. Thank you very much. See you in my next video.